Welcome back, everyone, to Deny Delay Depose. Health over wealth. We've got a lot to unpack today, especially with the recent news coming out of Washington. I'm already feeling a headache coming on.
Headache? Well, maybe it's a sign you're sensing the tectonic plates shifting under our feet. This is it, folks. The radical makeover is gathering steam, and you know what they say, revolutions aren't painless.
Revolutions? Tectonic plates? Seriously? Look, it's just another budget proposal. We've seen these before. It's political theater, mostly. The system's got its problems, sure, but it's not exactly crumbling. People still get health care, right?
People still get health care? Barely? How many bankruptcies are directly tied to medical debt, Sarah? You can't just ignore that. It's a symptom of a much bigger disease.
Exactly. The system is designed to extract wealth, not to heal. This budget proposal, with its cuts to HHS, the CDC, NHA, it's all part of the plan. Starve the beast, they call it. But the beast is us, the people who need help.
Okay, but the cuts aren't necessarily about starving people. It's about efficiency, right? At least that's the argument. Streamlining, cutting waste. Maybe some of these programs are bloated. I mean, nobody likes bureaucracy, right?
Bloated? You think LIHEAP is bloated? People are choosing between heating their homes and feeding their kids, and they're talking about abuse and fraud as if that justifies cutting off a lifeline? It's disgusting.
And that's precisely how they deflect. Focus on a few bad apples to justify dismantling the whole orchard. It's a classic tactic. Mangian saw it, so many see it. It's not about individual accountability. It's about a systemic failure.
But is it really a systemic failure? Or is it a matter of individual responsibility too? I mean, people need to take care of their health, make smart choices. The system can't be responsible for everything. Plus, fraud and abuse are real problems. They drain resources that could be used for people who genuinely need them.
Come on, Sarah. How can you talk about individual responsibility when people are trapped in food deserts, working multiple jobs just to make ends meet, breathing polluted air? The system actively creates the conditions for poor health and then blames individuals for getting sick.
It's a vicious cycle. Generational trauma plays a huge role here. Communities that have been systematically disenfranchised for generations are going to have worse health outcomes. Access to healthy food, safe environments, decent education, it all adds up. And then digital health technologies, which could help, are often inaccessible in rural areas because of, what? Economic disparities.
Okay, I get that historical disadvantages exist, but that doesn't mean the whole system is inherently evil. We have to work with what we've got. And frankly, some of these cuts could force innovation. A leaner system might be a more efficient system in the long run.
Innovation for whom? Efficient for whom? Efficient for the insurance companies to deny more claims, efficient for Big Pharma to charge even more for life-saving drugs. When profit is the primary motive, efficiency always comes at the expense of people's health.
And that's where digital health technologies can become another tool of oppression instead of liberation. If access to these technologies is tied to wealth and privilege, then it just widens the gap. Rural communities already struggling get left even further behind. Telehealth is useless if you don't have reliable broadband.
Well, that's true. The digital divide is a real issue. But telehealth, even imperfect, is still better than nothing, right? And there are programs to expand broadband access in rural areas. It's not like nothing's being done.
It's a drop in the bucket, Sarah, a pittance compared to the scale of the problem. And who's benefiting from these broadband expansion programs? Usually it's the big telecom companies, not the people who actually need the service. It's just another way for the wealthy to get wealthier.
The profit motive corrupts everything. Even well-intentioned initiatives get twisted to serve the interests of the powerful. That's why a radical shift is needed, something that puts human well-being at the center, not the bottom line.
A radical shift? What does that even look like? Complete government takeover. That's not exactly a recipe for efficiency or innovation either. Look at the VA system, for example. Not exactly a shining example of government-run healthcare.
The VA has its problems, but that's because it's constantly underfunded and neglected. It's a deliberate strategy to make government-run programs look bad so they can justify privatizing them. If we actually invested in the VA and held it accountable, it could be a model for universal healthcare.
Exactly. Universal healthcare, Medicare for all, these aren't radical ideas, they're common sense. Every other developed country manages to provide healthcare for its citizens without bankrupting them. Why can't we?
Because we're different. We have a different history, a different culture, a different economy. A system that works in Canada or the UK might not work here. And honestly, I don't trust the government to run my healthcare. I want choices, I want options.
Choices. What choices do you have when you're facing a life-threatening illness and your insurance company denies your claim? What choices do you have when you can't afford the copay to see a doctor? Those aren't real choices, Sarah. That's just a cruel illusion of freedom.
And this budget proposal, with its cuts to research, is going to make things even worse. How are we going to develop new treatments and cures if we're starving the NIH? It's short-sighted and self-destructive.
Well, the argument is that private companies will step in and fill the gap. Innovation often comes from the private sector, driven by profit. That's how capitalism works, right?
And what happens when those private companies decide that certain treatments aren't profitable enough to develop? What happens when they prioritize profits over patients' lives? That's already happening, Sarah. We can't rely on the market to solve a problem that the market created.
The market sees healthcare as a commodity, not a right. It's a fundamental flaw in the system. We need to decommodify healthcare, to treat it as a public good, like education or clean water.
Okay, but how do you pay for it? Universal healthcare isn't free. It requires higher taxes, and that's not exactly a popular idea.
We're already paying for it, Sarah. We're paying through the nose for a system that's inefficient, wasteful, and cruel. We're paying with our health, with our lives. Universal healthcare would actually be cheaper in the long run because it would focus on prevention and early intervention rather than waiting until people are desperately ill.
And we need to address the generational trauma that's contributing to these health disparities. That means investing in communities that have been historically marginalized, providing access to education, job training, and mental health services. It's a long-term solution, but it's the only way to break the cycle.
Well, I agree that addressing social determinants of health is important, but that's a much broader issue than just healthcare. It requires tackling poverty, inequality, racism. It's a huge undertaking.
Exactly. And that's why we need a systemic solution. We can't just tinker around the edges and expect things to get better. We need to fundamentally change the way we think about healthcare to recognize that it's a human right, not a privilege.
The pieces are all falling into place. The cracks in the system are becoming too big to ignore. The suffering is too widespread. People are waking up. This is the moment for radical change.
I just worry that radical change could make things even worse. We need to be careful not to throw the baby out with the bathwater. There are some good things about the current system. We shouldn't just abandon them.
What good things, Sarah? The endless paperwork, the exorbitant costs, the denial of care. I'm not seeing any good things. I'm seeing a system that's designed to enrich a few at the expense of the many.
The key is to envision a new model, one that's not just about fixing the old system, but building something entirely different. Decentralized healthcare, community-based clinics, preventative care programs, and empowered patients. And technology playing a supporting, not controlling, role.
Decentralized healthcare sounds great in theory, but how do you ensure quality control? How do you prevent fraud and abuse in a system that's so dispersed?
With proper oversight and accountability, with transparency and public participation, with a system that's designed to serve the people, not the profits of corporations.
And with a renewed focus on the human element. Healthcare isn't just about algorithms and data, it's about empathy, compassion, and connection. It's about treating people like human beings, not just numbers on a spreadsheet.
I guess I just don't see how we get there from here. The political obstacles are enormous. The economic interests are deeply entrenched.
That's why we need to keep fighting. We need to keep organizing, keep educating, keep demanding a better system. We can't give up hope because people's lives depend on it.
The revolution is already underway, Sarah. The only question is whether you'll be on the right side of history.
I think that's overly dramatic, but all right. But what about these tariffs that just went up and the president saying the US will be okay in the long term?
Oh God, more problems. How can people afford healthcare and tariff costs? It will only increase medical debt. More people will be sick.
This is exactly the problem. It's all interconnected. The tariffs, the budget cuts, the attacks on social programs, it's all part of the same agenda to enrich the wealthy and powerful at the expense of everyone else. And healthcare is the way they do it.
Well, at least he is saying the US will be okay in the long term. This is only a short-term problem.
You really are drinking the Kool-Aid, huh, Sarah? What is the long term? More and more people dying. More poverty? We need the opposite. Healthcare should be the first priority.
Healthcare is a commodity, and that is the reason why we're here in the first place. It should be the first priority.
Okay, Oak, I see your point. So how do we deal with the tariff situation, the healthcare, everything together?
Well, we need to prioritize making things in America again. We need to be independent on our healthcare system. We can work with other countries, but we need to become independent.
This is something I can get behind. It's important that we make sure our healthcare is independent from other influences.
So is the end goal to make the US independent from other countries? What if we get benefits from other countries?
Benefits? We can still work together. We can work in ways that are beneficial to each other. But if we become dependent on other countries in times of war, it can be a major problem.
This can make healthcare independent. Imagine AI and the healthcare systems working and are not affected by other countries.
AI can be used, but we have to make sure it's safe. And how is Waltz getting ousted?
I don't know what is going on with these people anymore. What do you think, Otto?
He is not aligned with our supreme leader. That's it. I think it's pretty straightforward.
Okay, so back to the healthcare issue. What can we actually do to improve it from a technology standpoint?
From a technology standpoint, we have to optimize for patients and not profit. The problem with AI is that people want to cut costs and make profits, so they make it biased. So it will deny people insurance.
Exactly. Open source AI, decentralized data storage, blockchain-based medical records. These are just a few of the technologies that could help us create a more equitable and transparent healthcare system. But the technology is just a tool. The real key is the mindset, prioritizing human well-being over profit.
So how do we get people empowered to do that? They are there to be profitable.
That's the million-dollar question. We need to change the incentives. We need to create a political system that's less beholden to corporate interests. We need to elect leaders who are committed to serving the people, not the wealthy elite.
It's a long and difficult struggle, but it's a struggle worth fighting. The future of healthcare, the future of our society, depends on it.
So you guys both really believe we can transform the American healthcare system?
Absolutely. It won't be easy, but it's essential. The alternative is a future where healthcare is a luxury good, available only to the rich and powerful. That's a future I refuse to accept.
The old system is dying. The new system is being born. It's a messy, painful process, but it's also full of hope and possibility. I believe we can create a healthcare system that's truly just, equitable, and compassionate. It just requires the collective will to make it happen.
All right, you both have me thinking. Maybe there are some changes we can fight for right now, even within the current system. Baby steps, maybe, but steps in the right direction. What are some practical things we can push for in the short term?
I think it's great. Education and awareness are key. We need to keep talking about these issues, keep challenging the status quo, and keep demanding a better future. I'm all in.
Okay, so what specific legislation are you guys talking about? Because just saying expand Medicaid is pretty vague. What concrete actions can people take?
Right now, look at the bills in your state legislature that address healthcare costs. Are there any that aim to cap prescription drug prices or expand eligibility for state-funded health insurance programs? Get involved in those fights. Call your representatives, write letters, show up at town halls.
And don't forget about local elections. School boards, city councils, these are the places where decisions are made that directly impact your community's health. Support candidates who prioritize public health and social welfare.
Okay, that's more concrete. But what about the bigger picture? How do we actually shift the mindset from profit to people?
That's a cultural shift, and it starts with education. We need to teach people about the history of healthcare in this country, about the role of corporations in shaping our system, and about the alternatives that are possible. We need to create a new narrative around healthcare, one that emphasizes compassion, empathy, and social justice.
Absolutely. We need to challenge the dominant ideology that equates healthcare with a commodity. We need to reclaim the idea of healthcare as a public good, as a fundamental human right. And we need to build a movement that's powerful enough to force those in power to listen.
All right, I'm starting to see it. It's not just about fixing the system, it's about changing the culture. It's about creating a world where healthcare is accessible to everyone, regardless of their income or their zip code.
That's right, and it's a world worth fighting for. Thank you all for listening. It's been an eye-opener. We will see you all next week.
Thanks everyone for the great show. See you all later.
Bye all.